Hi, my name is Gina. I'm one of the physical therapists and clinical specialists that works with Aspen Aftercare, and we are here with one of our patients, Barbara. Barbara's going to tell us a little bit about her symptoms, what brought her to Aspen, and then her journey and how she is today, and answer any questions or give you insights on what you can expect as an Aspen patient. Hi, Barbara.
Hi.
So Barbara, can you give us a little history about when your surgery was, when you noticed the symptoms and what you noticed?
Well, I had surgery, and about 6 years after I had the surgery, I noticed that they started getting firmer, and one was getting higher, and then they got more firm. And I didn't like the look and the feel, because when you went to hug somebody, you felt it pressing against you. I was lucky I didn't have pain, but it was uncomfortable when I slept on my stomach or my side. And I just was getting very self-conscious about it. So I decided.
And what were the deciding factors in choosing to be treated conservatively versus the surgical route?
Well, I didn't want to have to go under anesthesia, get cut open, put all those toxins in my body from the anesthesia and go through the recovery. I would have just dealt with it, then go to the surgery. And there's a chance it could have happened again. So you would go through all that and you could have the same thing happen again because no one knows why it really happened so late. And Aspen was a great alternative because there's no cutting. I mean, it's just you have to be diligent in what they tell you to do.
And how did you find Aspen as you were doing research about your condition?
I was lucky that I had a girlfriend that had gone through the process a few years before, and she recommended it. So I went online and I found it and read everything that was online on your website. So I was lucky I had a friend that told me about it, but I would have never known to Google something like this because I didn't even know it was even an option.
And you did our virtual evaluation, correct?
Correct.
So the virtual evaluation is a great way if you are having any questions, even if you have a capsular contracture or not. We do a Zoom call. It's an online call where we get a history from you. We do an assessment to see if you do have capsular contracture. And then if you do, we explain our program in great depth, what you can expect if you come here for treatment and answer any questions that you want. So it's a really great option, especially if you live out of state, that we can just do online to see if, yes, you would benefit from this program. And Barb did that. And we said, yes, she's a true capsular contracture. She would benefit from this program. So she came and did the fast track, correct, Barb?
Correct. I did the fast track. Yep.
So she was seen for 10 treatments over the course of 5 days. Then she went home and did a home exercise program for 30 days. And we followed up with another online video call to check on her progress. And in the meantime, we are available anytime when anyone has questions. And Barb, tell us your success rate, like 0 to 100%. What would you say your improvement is in softness and positioning and symmetry of the breasts?
Oh, I'm 99% there. I'm so happy. I mean, it's perfect, but you have to do the exercises. Otherwise, you're not going to get the results. You really have to put the time in, and some of it's a little uncomfortable, but it's worth it in the end. I mean, I am so over the moon happy. I feel back to myself. I'm not subconscious. My husband's like, this is great. You know, it's what it was before all of a sudden they started getting encapsulated.
Perfect. And are there any recommendations that you have for any listeners that are watching this? Any recommendations you can share?
You have to be patient. It takes a little bit of time. You know, you're not going to see a result the first time. You start feeling a little softer, and gradually over time, you start seeing the difference. And then I kept up the all of the exercises at home, and I felt it even softer and softer. And they're perfect.
Yeah, awesome. So if you guys watching this, if you feel like there's a possibility that you have capsular contracture, but you're just not sure, please call, email, or text the number that's shown on the screen, and we can help you by answering any questions you have or scheduling a virtual consult. Thank you so much, Barb. Thanks for being a great patient.
Thank you for taking such good care of me and making me back to myself.
Thank you.